Good afternoon. I'm Chris Dorman, President and CEO of Southwell. We are here today to discuss our first confirmed case of COVID-19 at Tift Regional Medical Center. I am joined by representatives with the City of Tifton and Tift County. Before we discuss our confirmed case at Tift Regional, we'll have some of our local leaders speak first. I turn it over to the Honorable Julie Smith, Mayor of Tifton.
Thank you, Chris. I'd like to also ask Alan Owens with Tift County EMS and Sheriff Gene Scarborough to join me. They will be addressing you as well. Today, city and county government issued local states of emergency. We are in constant communication with the Georgia Municipal Association, the Association of County Commissioners of Georgia, the CDC, the Department of Public Health, the Governor's Office, and our local partners. We do ask that our citizens self-quarantine. We ask that businesses such as spas, salons, gyms, bowling alleys, music venues, anywhere where people gather, close your business voluntarily to help stop the spread of COVID-19. We will be reaching out to our community suppliers, such as grocery stores and pharmacies, to see how we can assist them in the progress going forward for this community. We will provide regular updates as soon as they are available, so I invite you to please follow the City of Tifton Facebook page and follow the City of Tifton websites, as that information will be posted on those locations. We also ask that you please check on your neighbor. We have many elderly in our community, people who don't necessarily get the internet, people who don't have cable television, don't necessarily read the newspaper. Please check on your family and friends to make sure that they are okay, and if you can provide assistance to them and share this information, I think that will help us to all stop the spread of misinformation, which is just as dangerous as this virus. So again, in declaring the states of emergency, there is nothing mandatory at this time. We are asking that the self-quarantine be voluntary. We are asking that our community recognize a 9 p.m. curfew. If you need to be out after that hour for essential needs, such as to visit the pharmacy or to go to the grocery store or food pickup, we certainly understand that. But if you will please work with us, we will do everything possible and everything within our power to provide you with the most up-to-date information that we have available from our partners as we receive it. At this time, I would like to introduce Mr. Alan Owens with Tift County EMS to answer some questions. Thank you.
Most of the questions that are coming from the community for us are, how are we responding with calls? What we're doing is we're following the CDC, Department of Public Health, and the Office of EMS guidelines on how we respond to those calls. I'll turn it over to the Sheriff.
Good afternoon. As far as what the Tift County Sheriff's Office is doing in this dilemma is we're looking after our people as well as the citizens of Tifton and Tift County as best we can. I want to reassure everybody here that we'll be working closely with every entity that's here, the excuse me, the first responders, the medical staff, whoever is involved in it. But just know that we're here to assist any way that we can. What we're doing at the Sheriff's Office is we've gone into triage. Everything that's non-emergency is being handled by telephone, fax, or emails. We will still answer calls if emergency situations the best we can, trying to keep our contact with the public at a low risk and at low events and as least amount of personal contact as we can. But we're doing everything that's been advised to do as far as the equipment, the PPE equipment, and gloves and face mask and all that whenever we encounter our individuals at the Sheriff's Office or at the jail. The jail, we're not taking anybody unless it's required by law for them to be incarcerated. So we've gotten pretty close to 20 people already bonded out on their own recognizance, so that we clear up space in case we have to have people brought in or we have to put people into quarantine. But we'll be doing everything we can to keep this spread from happening at the Tift County Sheriff's Office. But just reassure that we'll be here for everybody to assist any way that we can. Thank you.
Thank you to each of you for your commitment to our communities. We're bringing everyone together today to announce our first confirmed positive case of COVID-19 at Tift Regional Medical Center here in Tifton. We're working closely with the Georgia Department of Public Health, the local city and county governments, the governor's office, as well as local EMS to ensure our communication is consistent across all channels. We're using a different format for our media event today in an effort to continue to demonstrate ways organizations can help to flatten the curve and comply with the recommendation to not create large groups of people. We're recording this event, which will be shared on a variety of media platforms. Thank you for joining us today. On behalf of your family, friends, and neighbors, all 3,300 members of our Southwell family, we appreciate your willingness to assist us in disseminating the most accurate and up-to-date information to communities we serve. I would like to take a moment to thank the team of professionals who I have had the pleasure of serving alongside every day at Southwell. They are rising to the ever-evolving challenge, and I am extremely grateful for their unwavering willingness to serve our patients despite such uncertain circumstances. Our team is highly skilled, experienced, and very passionate about serving our patients and each other. We know the community is counting on us, and we are working around the clock to serve you. I would also like to take a moment to thank the heroes who have dedicated countless hours volunteering time, talent, and supplies to help create or otherwise secure face masks, gowns, gloves, safety goggles, and numerous other safety equipment needed to best care for our patients. You all are saving lives. Thank you very much. Here with me today are members of our physician executive team, Dr. David McKeachin, our Chief Medical Officer, Dr. Cameron Nixon, Chief Transformation Officer, Dr. Kane Brown, Chief of Staff and Chief Medical Information Officer, and Dr. Rubal Patel, Chief of Pulmonary and Critical Care. Dr. Eric Paulk, Chief of Emergency Medicine, and Dr. Willie Serena, Chief of Infectious Disease, have both been very active in helping to solve this problem, but both are doing what they do best and taking care of patients and couldn't join us at this time. I will now turn it over to Dr. McKeachin, and he will share his response from the medical staff. Thank you.
Thanks, Chris. My name is David McKeachin, like Chris said, and I'm the Chief Medical Officer of Southwell. I'd like to take this opportunity to share a few more details about our first positive case and to share our current patient status report and to inform you of the things that we're doing to reduce the transmission of COVID-19 in our community. We received our first confirmed positive case late yesterday evening. The patient is still being treated at Tift Regional Medical Center at this time. We've notified all the staff who have come into contact with the patient, and we're following up with each of them individually. Currently, we have 27 patients that have been tested for COVID-19. Fortunately, 15 are negative. 11 of the results are still pending. We'll continue to update the community as more information on these results becomes available. One of our highest priorities during this time is to keep our staff, patients, visitors, and community safe by preventing the spread of COVID-19 as much as possible. And I'd like to go over a few of the things that we're doing to try to help make that happen. First, we're going to continue to urge the community to utilize the toll-free hotline that's been set up. The hotline allows individuals to speak directly to clinical staff. The number is 877-719-5787. This number is available 24 hours a day, 7 days a week. If you're exhibiting any signs of COVID-19, you should call this number before you go to any healthcare facility. We're also limiting visitors at all of our facilities, and that includes our outpatient clinics. There are some exceptions that are listed in our guidelines. Internally, we're implementing many measures to reduce the spread of COVID-19. We're making sure that our staff stays safe through the use of proper protective equipment, including gowns, gloves, and masks. We're also utilizing technology to eliminate or reduce the number of face-to-face meetings that we have to have. We began screening our employees yesterday for any signs of infection. They're being screened for temperature and with a questionnaire before they can enter the building. We're also implementing a new travel policy which will track any employee travel outside 30 miles from their workplace. We're emphasizing the importance of proper disinfection. We ensure that the environmental cleaning and disinfection procedures are followed consistently and correctly. I want to express my gratitude to all our clinical staff for their dedication. Thank you for working hard and also for working smart. There are a few questions that our media partners have asked us to address, and I'm going to invite Dr. Kane Brown next to discuss those questions and their responses. Thank you.
Thank you, Dr. McEachin. I'm Kane Brown, the Chief of Staff at Southwell. I will next answer a few questions that have been submitted to us from the media. The first question is, what is the age and gender of the positive patient? Due to patient privacy concerns, we are not releasing this information at this time. Our family members, medical personnel, and other people being tested who have had direct contact with the patient. Has anyone who came into contact with this patient been quarantined or reported experiencing symptoms? The ongoing safety of our patients, staff, and communities will remain our primary focus. We are using guidelines and recommendations from the CDC and other leading medical organizations to guide us with decisions regarding exposures. Those that have been in contact with the patient are not currently having symptoms. What will you do if an employee becomes infected? We have a process we follow from the CDC based on the type and duration of the contact that determines what steps we take, which may include quarantine, testing, or other precautionary measures. How long is it taking you to get tests back? Initially, it took us about 5 to 7 days to obtain test results. More recently, we are seeing results in 48 hours. There is some variability in the time it takes to get testing back. We are currently developing the capability to process tests in our own laboratory. We hope to offer this soon, which will expedite the process greatly. Do you have a shortage of tests? At this time, we do have a limited amount of test kits, but we are not at a critical level. Where are you testing patients when they have symptoms? We are asking patients with symptoms to call our hotline that Dr. McEachin mentioned before going to the emergency department or any of our clinics. Our case managers will then direct the patient to one of our convenient care clinics if testing is warranted. We have convenient care clinics in Tifton and Adel. Are there plans for drive-through testing at TRMC or Southwell facilities? If so, how soon might that be available? We are currently exploring methods to speed up testing, including a drive-through option that may be coming soon. We will update you as that evolves. How do you stand regarding necessary medical equipment, particularly personal protective equipment and ventilators? We are assessing our inventory daily. We are also looking at non-traditional resources such as dental vendors, hardware stores, retail shops, local colleges, and more due to supply shortages nationwide. We see that Phoebe is making their own personal protective equipment supplies. Are you doing that also? We implemented an innovation team to work with commonly available supplies to make supplementary protection equipment. We have also received an outpouring of support from the community, which has been great. Many volunteers within our service area have contacted us to help produce these items. The community support has really been amazing. Others wanting to help are encouraged to contact us through our website at tiftregional.com for more information. We understand that you have put a lot of precautionary measures in place. Do you plan to do anything else now that you have a confirmed case? We have been planning for the arrival of COVID-19 for several weeks. From the beginning, we have been proactively treating any symptomatic patient as a positive case until their test comes back negative. We focus our daily planning 4 to 5 days out and make changes as needed in anticipation of an increased volume of cases. The excellent relationship between our clinical and administrative staff is paying large dividends when it comes to working together and responding quickly. Along with confirmed patients, are there other presumed positive cases at your organization? Yes, we have several patients awaiting test results. Until we receive those results, we are using necessary precautions in treating patients as if they were positive. What can the community do? The CDC is recommending we should avoid any gatherings of more than 10 people for the next 8 weeks. Do you agree? Yes, we do agree. We encourage you to abide by the curfew as outlined by Mayor Smith. We also ask you to practice hand hygiene and social distancing. Avoid close contact. Avoid contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at high risk for complications due to other medical conditions. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place, after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. We thank you for your attention today, and we ask you to please practice safe hand hygiene and social distancing. Thank you.